Part A. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I understand you've been experiencing some terrible bouts of abdominal pain for the past few months. Could you describe what's been going?
Good morning, doctor. Yes, it's usually in the lower left side of my abdomen, and it comes and goes. At first, I thought it was just something I ate, but it's getting worse. The pain can be so intense that I feel nauseous, and sometimes I have a bit of fever when it flares up. I've also been really constipated, but when I do manage to go to the bathroom, it can be quite painful.
I see. It sounds like the pain is quite disruptive. Have you noticed any other symptoms, Mihira?
I feel bloated all the time. Sometimes my stomach is so tight, and I've also noticed some changes in my bowel habits. Like I said, I'm constipated most of the time, but then I have these short episodes of diarrhea. I feel like something's wrong, but I don't know what.
That must be quite uncomfortable. Let's go over your medical history. Have you been diagnosed with any gastrointestinal conditions in the past? Are you on any regular medications?
Well, I've had issues with irritable bowel syndrome in the past, but nothing like this. I've been taking Buscopan on and off for the cramping, and I tried lactulose for constipation, but it's not really helping anymore. My GP also prescribed mebeverine a few months ago to relax my gut, but I've stopped taking it because I didn't feel much improvement.
And how long have you been dealing with these symptoms?
It's been almost 6 months now. I thought maybe it would just go away, but it's only getting worse. My diet hasn't changed much either, so I don't understand why this is happening now.
I understand. What about your family history, Mihira?
My father has had some issues with peptic ulcer disease, I believe, but nothing serious. He was told to eat more fiber, and it's been manageable for him. But I don't think that's what I have, doctor.
I see. Given your symptoms, particularly the abdominal pain, changes in bowel habits, and bloating, I'm starting to suspect that you may be dealing with diverticulitis.
But I thought that was more common in older people. I'm only 40. I'm just not convinced, doctor. So, how do we confirm if it's really diverticulitis?
We'll need to do some more tests to be sure. I'd like to order a CT scan of your abdomen. This will give us a clear picture of the colon and whether any pouches are inflamed. Mihira, we may also run some blood tests to check for signs of infection.
I've already had an ultrasound, though, and nothing really showed up. Will the CT scan be different?
Yes, the CT scan is more detailed than an ultrasound for this type of issue. It can help identify small abscesses that an ultrasound might miss. Based on those results, we'll have a better idea of the exact cause.
All right. What's the treatment if it is the case?
Treatment usually involves antibiotics to tackle any infection, and will adjust your diet to help your digestive system heal. I'd recommend starting with a low-fiber diet during flare-ups to give your colon time to recover. Once the inflammation settles down, we can gradually reintroduce more fiber to prevent future episodes.
Thank you, doctor. I just hope we get to the bottom of this soon.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a patient called Mihira. You now have 30 seconds to look at the notes. Good morning. How are you feeling today, Mihira? What brings you in to see me?
Good morning, doctor. I've been having these chest pains for a few weeks now. It's not exactly sharp pain, but more of a heavy pressure. It tends to happen when I'm walking or going upstairs, and sometimes my left arm feels numb or tingly. I also get short of breath quite easily, which is unusual for me.
That sounds concerning. How long have you been experiencing these symptoms?
It's been about a month now, but it's getting worse. At first, I thought it was just because I wasn't exercising enough, but now I feel exhausted even after doing simple things like grocery shopping. The heaviness is the most uncomfortable, especially because it makes me anxious. I can't do the things I usually enjoy, like walking with my friends.
Thank you for sharing that, Mihira. These symptoms could be linked to several cardiovascular conditions, so let's talk about a few more details to get a clearer picture. Do you have a family history of heart disease or any other medical conditions?
Yes, my father had a heart attack when he was 55, and my mother has high blood pressure. My uncle also had a stroke a few years ago. Heart problems seem to run in the family.
That family history is important to note. Based on what you've described, I'm concerned that you might have atherosclerosis.
Oh, that sounds serious. So what's the next step?
We'll need to run some tests to confirm the diagnosis and see how advanced the condition might be. I'll start by ordering a blood test to check your cholesterol levels, as high cholesterol can worsen plaque buildup. Next, we'll do an electrocardiogram, ECG, to measure the electrical activity of your heart. Mihira, I'd also recommend a stress test to see how your heart performs during physical exertion. Lastly, I may suggest an angiogram, which is a special type of X-ray that allows us to see how your blood is flowing through your coronary arteries.
That sounds like a lot of tests. What happens if I do have the condition?
If the tests confirm the condition, we'll need to start treatment immediately to prevent further complications. Treatment often involves lifestyle changes, medication, and sometimes procedures to improve blood flow. I'd recommend medications like statins to lower your cholesterol, and possibly aspirin to help thin the blood and reduce the risk of clots. Mihira, we may also consider beta blockers to help reduce your heart's workload.
How long would I need to take these medications?
Typically, these medications would need to be taken long-term, potentially for the rest of the life, to manage the condition. Mihira, we'll monitor your progress with regular checkups.
Thank you, doctor. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen.
Now look at question 25. You hear a nurse called Mihira talking to a junior nurse. Now read the question.
Nurse Ryan, as a triage nurse, your role is crucial in ensuring that patients receive timely and appropriate care. You'll be responsible for assessing patients' conditions and prioritizing their treatment.
I understand. What are the key factors to consider when assessing a patient's condition?
The ABCDE approach is a helpful framework. A stands for airway, B for breathing, C for circulation, D for disability, and E for exposure. We need to assess each of these factors to determine the patient's immediate needs.
What should I do if a patient arrives with a life-threatening condition?
Immediately alert the emergency response team and initiate appropriate life-saving measures. We'll need to stabilize the patient's condition before moving on to further assessments.
What about patients with less urgent conditions?
We'll need to prioritize care based on the severity of their symptoms. Patients with critical conditions will be seen first, while those with less urgent needs may need to wait.
Now look at question 26. You hear a nurse called Mihira talking to a doctor. Now read the question.
Nurse Ryan, I'm concerned about Mr. Peter's deteriorating condition. It's time to discuss end-of-life care options with him and his family.
That's a difficult conversation to have. Should I initiate the discussion or would you like to speak with them directly?
I think it would be best for me to have a direct conversation. I can explain Mr. Peter's prognosis and discuss the available options.
I'll schedule a meeting with Mr. Peter and his family to address their questions and concerns.
We'll need to provide them with information about palliative care, hospice services, and other end-of-life options. It's important to support them during this challenging time.
Are there any specific concerns or preferences that Mr. Peter has expressed regarding his end-of-life care?
He's previously mentioned a desire to avoid prolonged suffering and to be comfortable in his final days. We should discuss his wishes with his family and ensure they understand the available options.
Now look at question 27. You hear a GP called Mihira talking to a doctor. Now read the question.
Dr. Ryan, I'm concerned about Mr. Peter's persistent headache. He's been experiencing pain for several weeks, and it's affecting his daily activities.
That's concerning. Have you ruled out any underlying medical conditions?
Yes, we've conducted thorough examinations and tests, including a CT scan and blood work. The results haven't revealed any specific abnormalities.
It's possible that the headache is related to stress, anxiety, or other psychological factors. Have you considered a referral to a neurologist for further evaluation?
That's a good idea. A neurologist can assess for any neurological conditions that might be contributing to the headache.
We could also explore alternative treatments, such as physical therapy or relaxation techniques. These approaches can help manage pain and reduce stress.
I'll schedule a referral to a neurologist and discuss alternative treatment options with Mr. Peter. We need to address his headache to improve his quality of life.
Now look at question 28. You hear a community nurse called Mihira talking to a doctor. Now read the question.
Dr. Ryan, I'm concerned about Mr. Peter's emotional state following his recent surgery. He seems to be experiencing symptoms of depression.
That's concerning. Depression can be a common side effect of surgery, especially after a major procedure. Have you noticed any specific changes in his behavior or mood?
He's been withdrawn, isolating himself from others, and expressing feelings of sadness and hopelessness. He's also lost interest in activities he used to enjoy.
Those are all signs of depression. It's important to address this promptly to prevent it from worsening.
I've tried to encourage him to engage in activities and spend time with loved ones, but his symptoms persist.
We should consider a referral to a mental health professional for a more in-depth evaluation and treatment. They can provide appropriate counseling and support.
That's a good idea. I'll schedule an appointment with a therapist and discuss the situation with Mr. Peter. Now look at question 29. You hear a pharmacist called Mihira talking to a nurse. Now read the question. Nurse Ryan, I'm concerned about Mr. Peter's medication regimen. His doctor has prescribed a new medication that might interact with one of his existing medications.
That's a good point. Let's review his medication list and identify any potential conflicts.
I've analyzed his medications and found that the new medication could increase the risk of bleeding if taken with his blood thinner.
That's a serious concern. We'll need to adjust one of the medications or find an alternative.
I've researched alternative options and believe we can switch Mr. Peter to a different blood thinner without compromising his treatment.
That's great. I'll inform the doctor about the potential drug interaction and the recommended alternative.
Please ensure that Mr. Peter is aware of the change in medication and any potential side effects. We should also monitor him closely for any signs of bleeding.
Now look at question 30. You hear a GP called Mihira talking to a nursing manager. Now read the question.
Nurse Ryan, I've received Mr. Peter's CT scan results. There are some concerning findings that require further evaluation.
I'm sorry to hear that. What are the findings?
The CT scan shows a mass in the lung. We'll need to conduct a biopsy to determine the nature of the mass.
Should we inform Mr. Peter about the findings?
It's important to be honest with Mr. Peter. We should schedule a meeting to discuss the results and explain the next steps.
Will he need any additional tests or procedures?
Yes, a biopsy will be necessary to determine if the mass is benign or malignant. We'll also need to assess his overall health and determine the most appropriate treatment plan.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a Dr. Mihira, and an interviewer.
Dr. Mihira, thank you for joining us today. To begin, your recent research on listeriosis has been receiving a lot of attention. Could you tell us what exactly the study focuses on and why listeriosis is such a critical area for research?
It's my pleasure to be here. Listeriosis is a bacterial infection caused by Listeria monocytogenes, and while it's relatively rare, it's extremely dangerous, particularly for certain high-risk populations. These include pregnant women, newborns, the elderly, and individuals with weakened immune systems. Our study delves into the interaction between Listeria and the endocrine system, particularly focusing on how hormonal changes, such as those seen in pregnancy, can exacerbate the severity of the infection. Listeriosis often presents unique challenges in pregnant women because the bacteria can cross the placental barrier, leading to complications like premature birth, miscarriage, or stillbirth. The research aims to uncover how these hormonal shifts influence the bacteria's virulence and the body's immune response. While we are indeed interested in clinical outcomes, much of our focus is also on understanding the underlying mechanisms at the cellular and molecular levels, especially those that differ depending on hormonal fluctuations.
Fascinating. I imagine starting a study of this scale and complexity must have involved a lot of groundwork. Dr. Mihira, could you walk us through how your study began and what initial steps were required to get it off the ground?
Absolutely. Initiating a study of this nature required a multidisciplinary approach. We began with a comprehensive literature review to identify gaps in current research. There's been significant work on Listeria monocytogenes, but little attention has been paid to how it interacts with hormonal changes. We then sought to design a study that could bridge that gap. Initially, our work involved gathering data from epidemiological records, focusing on cases of listeriosis in pregnant women and correlating the outcomes with hormonal data. That wasn't easy, though, because the data needed to be precise and reliable over an extended period. We had to collaborate with multiple hospitals and public health agencies to access patient records while ensuring compliance with ethical standards and maintaining patient confidentiality. The real challenge came in refining the parameters for experimentation, particularly because hormonal influence is a variable that fluctuates even within the same individual over time. We needed a well-defined, controlled environment, which led us to use both in vitro and in vivo models, involving cell cultures and animal studies to explore the mechanisms at a deeper level.
It sounds like a massive undertaking, Dr. Mihira. Could you elaborate on some of the significant challenges you faced during the study?
One of the main challenges was indeed managing those hormonal fluctuations. Hormones such as estrogen, progesterone, and cortisol all have varying impacts on immune function, and isolating the effects of each was complicated. Additionally, Listeria is a particularly tricky bacterium because of its ability to hide inside cells, where it can evade many of the body's immune defenses. Our task was to determine how hormone levels altered both the bacterium's behavior and the immune response. Another significant challenge was the ethical and logistical considerations involved in studying pregnant women, particularly in vulnerable populations. Conducting clinical trials in these groups is not always feasible or ethical, so we had to rely heavily on animal models and in vitro studies, which present their own set of limitations. Moreover, creating a balance between clinical relevance and experimental control was another hurdle. Human biology is complex, and while we strive for accuracy, translating our findings from the lab to real-world applications is an ongoing challenge.
With those kinds of challenges, it's clear that progress must be incremental. However, have there been any recent developments in the study that have shifted your approach or led to breakthroughs, Dr. Mihira?
Interestingly, our recent development involves a potential breakthrough in understanding the molecular pathways affected by hormone levels, particularly during pregnancy. We've identified a specific receptor pathway that Listeria seems to exploit in the presence of heightened progesterone levels. This receptor, which plays a role in modulating immune responses during pregnancy, seems to create a favorable environment for Listeria to thrive, bypassing immune defenses. What's particularly exciting is that this receptor pathway could be a potential therapeutic target. By focusing on blocking this pathway, we might be able to develop treatments that prevent listeria from taking advantage of hormonal changes, thus reducing the risk to pregnant women and their unborn children. However, we're still in the early stages of testing this hypothesis, and clinical applications are a long way off.
That's truly groundbreaking, Dr. Mihira. What are the expected outcomes of your study as you move forward?
The primary goal is to develop a deeper understanding of how hormonal changes during pregnancy and other physiological states influence the course of listeriosis. We expect that this could lead to more targeted preventive measures and treatments. For instance, we're hoping to pinpoint biomarkers that could predict the severity of infection in high-risk individuals. Moreover, we're exploring the possibility of developing hormone-based therapeutic interventions that could either prevent infection or mitigate its effects. Of course, we are still some distance from translating these findings into clinical practice, but the long-term outcome would ideally be a reduction in the morbidity and mortality associated with listeriosis in vulnerable populations. Our work could also influence public health policies by emphasizing the need for targeted screening in pregnant women, especially those with hormonal imbalances or pre-existing conditions.
And finally, Dr. Mihira, how do you see this study impacting the wider medical community and public health?
The broader impact of our study could be substantial. By revealing the interplay between hormones and bacterial infections, we could open up new avenues not only for listeriosis but for other infectious diseases that may behave differently in the presence of hormonal changes. Our research could push for more personalized medicine approaches, where a patient's hormonal profile is taken into account when developing treatment plans for bacterial infections. From a public health perspective, we're hoping that this study will lead to better screening protocols for pregnant women and perhaps even hormonal therapies that could protect high-risk populations. Additionally, if we succeed in identifying a molecular target for therapeutic intervention, the impact could extend to developing broad-spectrum therapies that protect against intracellular bacteria more generally. While listeriosis is our primary focus, the principles we're uncovering could have much wider applications.
Now look at Extract 2. Questions 37 to 42. You hear a psychiatrist, Matt Wilson, talking about the unforgettable journey in his career. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, I'd like to take you on a journey with me through a case that has profoundly impacted my career as a psychiatrist. It's the case of Mihira, a patient whose struggle with pica, an eating disorder characterized by the persistent consumption of non-nutritive substances, left me with lasting lessons on human resilience, the complexity of mental health, and the importance of interdisciplinary collaboration. Mihira was not an ordinary case. While we often see various manifestations of eating disorders in our practice, pica remains a rare and particularly challenging diagnosis, especially in an adult. What makes Mihira's case even more memorable is her background. She was highly educated, held a demanding corporate job, and came from a close-knit family. On the surface, she didn't fit the typical profile of someone struggling with a disorder like pica. Yet, beneath this facade of success and stability, Mihira's compulsion to eat paper, chalk, and even small metal objects consumed her life, both physically and mentally. The reason I remember her so vividly is not just the medical complexity of the case, but the sheer juxtaposition of her outer life and her inner turmoil. The psychological burden of balancing these opposing realities seemed to compound her condition, and it was as though she was constantly trying to hide in plain sight. This duality challenged me as a psychiatrist in ways I hadn't anticipated, forcing me to reconsider many aspects of diagnosis and treatment. One of the most challenging moments in Mihira's treatment came during a particularly severe episode where she had ingested a large amount of paper, resulting in a bowel obstruction. This medical crisis brought her to the hospital, and it was in this context that I was called in to consult. What made this situation even more delicate was Mihira's reluctance to admit that her compulsion to ingest non-food items had become life-threatening. Despite the clear physical evidence, she insisted that her behavior was under control, and that the incident was a one-off accident. As a psychiatrist, I had to weigh several competing factors. On one hand, there was the immediate medical need to stabilize her physically and address the bowel obstruction. On the other hand, there was the psychological battle she was waging, her deep-seated denial, which had become a core defense mechanism. The decision I faced was whether to proceed with a traditional medical intervention, followed by voluntary psychotherapy, or to push for a more invasive psychiatric intervention, possibly involving an involuntary hospitalization. After lengthy discussions with the multidisciplinary team, I ultimately opted for the latter. The acute nature of her physical condition, combined with her psychological denial, made it clear that without addressing both aspects of her disorder head-on, we risked further medical emergencies in the future. Once Mihira was stabilized, I realized that the long-term treatment plan needed to be multifaceted. Pica is a condition often deeply rooted in psychological issues, and it frequently coexists with other mental health disorders, such as obsessive-compulsive disorder or severe anxiety. I knew that Mihira's treatment couldn't merely focus on suppressing her compulsion to ingest non-nutritive substances. It had to target the underlying emotional and psychological factors driving her behavior. The plan I devised involved cognitive behavioral therapy, CBT, with a specific focus on identifying and disrupting the thought patterns and triggers that led her to engage in pica. Additionally, given her high levels of anxiety and stress related to her work and family life, I recommended mindfulness-based stress reduction, MBSR, techniques as an adjunct therapy. Pharmacologically, I decided to cautiously introduce a selective serotonin reuptake inhibitor, SSRI, which has shown efficacy in treating compulsive behaviors. Finally, I incorporated psychoeducation to involve her family in understanding pica and its psychological roots, helping them to provide the appropriate support and avoid enabling behaviors. The success of Mihira's treatment was not due to any single intervention but rather the seamless collaboration between multiple disciplines. The initial medical emergency required the expertise of a gastroenterologist, and once stabilized, her care moved into the realm of psychiatry and psychology. I worked closely with her therapist to ensure that her cognitive behavioral therapy aligned with her broader psychiatric treatment. Additionally, nutritionists were involved to assess any nutritional deficiencies or imbalances caused by her pica behaviors, and occupational therapists helped her develop alternative coping mechanisms for stress. Coordination with her general practitioner was also crucial for monitoring her physical health, particularly her gastrointestinal condition, which was at constant risk due to her past behaviors. This integrated approach ensured that no aspect of her health was overlooked, and the frequent team meetings ensured that her care plan remained cohesive. After months of intense work, both physically and psychologically, the results were promising. Mihira's physical health stabilized, and the risk of future medical crises diminished significantly as she began to refrain from ingesting non-food items. Psychologically, the progress was slower but equally significant. Her compulsions decreased in intensity and frequency, and she began to develop healthier coping mechanisms for dealing with stress and anxiety. However, the real victory was in her own perception of her disorder. From being in complete denial, Mihira gradually moved to a place of acceptance, acknowledging her disorder and actively participating in her recovery. This case has left an indelible mark on my career. As psychiatrists, we often walk the fine line between addressing the medical and psychological needs of our patients, and Mihira's case was the epitome of that balance. It reinforced my belief that no disorder exists in isolation. Pica wasn't just about eating non-food items, but about deeper emotional and psychological issues that demanded a holistic approach. It was a reminder that while diagnoses may be specific, treatment plans must be comprehensive, integrating multiple layers of a patient's life. Mihira's progress affirmed the power of multidisciplinary collaboration, and it highlighted the importance of persistence and empathy in psychiatric care. Her journey was a testament to the fact that even in the face of deeply ingrained behaviors, change is possible with the right support system.
That is the end of your OET listening test. Now check the answers.